and welcome to Boomer Health at Home. I'm your host, Maggie Ornazian, Director of Nursing at AmeriStaff Nursing Services. Today, I'm joined by a colleague and friend of mine, Pharmacist Karen Rates. Hi, Karen. How are you today?
Hey, Maggie. I'm good. How about you?
Very good. Thank you. Thank you for joining us today.
Yeah, it's my pleasure.
So today we're going to talk about intravenous infusions in the home and in outpatient settings and what kind of health boosts they give for us and what the advantages are of getting them outpatient and in your home.
Okay, that's great, Maggie.
So what are the benefits of home IV therapy?
Well, there are a lot of benefits to doing infusions at home or IV therapy at home. First of all, it gets the patient out of the hospital. So they can be in the comfort of their home where they can be with family, certainly more convenient for the family and the patient. But it also saves expense. Some IV therapies take weeks or some are ongoing, like, TPN can last for a really long time. And so you save the expense of the patient being in the hospital. A lot of people also think there are fewer complications in the home. A lot of people are reluctant to go to the hospital. So there's a lot of advantages. It's really a very safe and effective alternative to getting an IV in the hospital.
Especially now with the pandemic, I think a lot of people are staying home.
Yeah,
seeing that in the ERs and, in our home care sector as well, people want to stay home now. They're scared.
Yeah, right. They are. And, for a while you couldn't go visit someone in the hospital. So yeah, it's so much easier and more convenient. It's very safe and effective.
Great. That's good. And I think that's what people want. And that's where we're geared towards healthcare now.
Yes.
We're really looking at quality and safety, and that's big initiatives.
Yeah.
So Karen, you had mentioned TPN. And for those at home that don't know, what are some different types of IV infusions that you can get? And what does TPN actually stand for?
Okay. So, let's start with TPN. So TPN is total parenteral nutrition. It's intended for people who can't typically eat normally. So they can't ingest enough calories to not just sustain their bodily functions, but to get well. When you're sick, when you have trauma, when you've had surgery, your body requires extra nutrients, extra protein in order to heal itself. So sometimes it's the patient can't eat at all. Sometimes it's just really to supplement what they're able to intake orally. But it's a way to give a patient everything they need. You get vitamins, you get fats, sugar, protein. Protein is so important for healing and maintaining all your bodily functions. So what we try to do with TPN is infuse it over, say, 10 or 12 hours at night while a patient is sleeping anyway, resting. And we're typically able to get everything the patient needs in that time frame. So it's a larger IV bag. I brought an IV bag. This is a 1 liter bag. Typically TPN is 2 or 3 times this size.
Wow.
So it's a large IV that's infused over several hours. Other types of IV therapies that we can do in the home, probably the most common is antibiotics. So antibiotics are often needed to be given IV sometimes for 6 to 8 weeks, depending on the type of infection. Typically, it's the type of antibiotic that can't be taken orally or isn't as effective orally. So it's needed to be given in an IV form. Sometimes it's once a day. It can be 4 times a day, 6 times a day, but it usually is in a smaller IV like this size. Oh. This one is a 100 ml bag, 100 milliliters. So, and so it can be what we call an IV piggyback and given periodically throughout the day and delivers most often antibiotics. Sometimes we're able to put the medication in a really small amount of fluid. This actually has some medication in it This is just 15 milliliters, and it can be given IV push instead of piggyback. So this applies to antibiotics as well. Lots of times what we're doing is an infusion that's required every 6 weeks or every 8 weeks. And either the patient would typically go to a doctor's office or to the hospital to get the infusion. But many medications now are able to be given very safely in the home over a couple of hours or an hour in the home, and keeps the patient from having to go to the office or to the hospital to get the infusion. So typically those drugs are, I'll just name a couple, like infliximab, which is Remicade. It's used for autoimmune disease. And so patients who require that can just easily get their medication at home instead of going into the office.
And the way these patients become candidates for home IV therapy, is this something that their doctor and them, they kind of go together as like a plan of care upon discharge or while they're in the office?
Yeah, that's a great question. So usually there's a person who's really coordinating care in the hospital for the patient. And that person is aware of these other services and other ways of taking care of patients, and might actually suggest it to the physician if the physician hasn't thought of it already for these, really extended periods of time. But yeah, it's really a team approach. The care coordinator in the hospital might identify the patient. The physician might identify the patient. But what happens is, as soon as the patient's identified as a candidate, we look at a whole bunch of factors. So how stable is the patient? How feasible is it to give the medication in the home instead of in the hospital? And the feasibility really depends on the medication being used, the support system for the family, the ability of a nurse to go to the home. It really is quite a team approach in evaluating patients to see who's a candidate.
Yes, I think what I've noticed in my short stint here in home care is you think you want to be in your home, and then you realize there's going to be other people in your home that are not your family or your friends that are invading your space. And it can be a little uncomfortable at first.
Yeah, it can be uncomfortable, but I would hope it'd be comforting, knowing that someone's coming in, they're evaluating you and your situation, making sure things are done properly, make sure that, it's a clean environment, the medications are being stored properly. One really great thing is that labs can be drawn in the home as well. So it prevents you from having to go back to the hospital or the doctor's office to get labs drawn. So, that nurse that comes to the home is a great resource for the family. And should be an opportunity to ask questions and, hopefully a welcoming person that's seen as somebody who's helping.
Yes, absolutely. Mm-hmm. A compassionate nurse in the home, that would be key, right?
Yes, for sure.
So that's good. Yeah, and I really think that it keeps the standard of quality up then, especially with patient care. And, as in healthcare, we're always looking for new innovative ways. And this is something that takes us beyond the walls of the hospital and really caters to the community and the issues at hand. And I think it's a great way of delivering patient care. It really is.
It is. It really is. And it is quite a team approach. Everyone from the doctor, the nurse, the pharmacist, and the family, the patient and the family.
So there's some high expectations and there's accountability that goes into this.
Yeah, absolutely. Yeah. We all have our protocols, the way we take care of patients. We know what to expect and what to look for, and, really how to take care of a patient in the home, how to prepare the medications as well as administer them. One great thing is, we're all about quality of care. RxIV, home infusion, AmeriCare nursing are CHAP accredited. So, we have someone coming in and looking at the way we do things and making sure that we're at the highest standards possible. The pharmacy mixing the IVs is also accredited by a separate organization that looks at quality. So yeah, quality of patient care is really important to us, and we have very high standards.
Oh, that's great news. That's wonderful. And it's a benefit to the patient.
Yeah, for sure.
Great. So now that we've kind of gotten the scope of what's appropriate and what kind of patients to expect, what are the different types? I know we touched on TPN, but what are some other types of IV therapy in the home?
Yeah, so we're really doing all kinds of new things because you're right. We're thinking all the time about how we can think outside the box and take best care of patient. And I think COVID really had us all looking at things differently. Yeah, I think our organization has done a great job of doing that through the years. But boy, a year ago we had to really start looking at things differently in how we do patient care for sure. So IV hydration is one thing that can be done in the home that's pretty common. Sometimes we'll have pregnant women who are suffering from hyperemesis. So they're vomiting, they have the nausea and they're not able to get enough hydration. So, hydration is a real common thing that we can do in the home. Give someone IVs to keep them hydrated, also give them vitamins, multivitamins, trace minerals, things like that can be used in those IV bags as well. Yeah, so, we talked about antibiotics. We're seeing some kind of unique things these days with, some people are really into high dose vitamin C or something called a Myers cocktail, which is a really unique way of getting vitamins and nutrients. People with fibromyalgia, chronic fatigue, some of those people can't absorb nutrients very well. So a great way to supplement what they're not able to eat or they're not able to absorb what they are eating is a great way to give some nutrients. So we're seeing some unique things with those kinds of patients in home IV as well.
So there is an option for home IV to not be covered by insurance in a sense and just get some hydration, get some vitamins in you if that's something you so choose. So you've done your own research and you can inquire about that. You don't need a doctor's prescription. Is that correct?
Well, actually, you do need a doctor's prescription.
Oh.
So, but we can help get that prescription for you as well. We have a team of doctors that do prescribe these kinds of therapies. And we can work with you. We can kind of be, a part of a triad. The physician, the patient, and the pharmacy can work together to get that prescription so that we can get you cared for in the home. And we're doing more and more of these kinds of treatments where people are electing, you've read about high dose vitamin C for the immune system or a Myers cocktail, it's called, which has, multivitamins, magnesium, calcium, vitamin C, and it really helps boost the immune system. So we're getting, more and more demand for this, especially in this age of COVID.
Yes, absolutely.
Mm-hmm.
Absolutely. And just for any of our non-medical viewers as well. So an IV is something that can be put in that day. We infuse whatever the doctor prescribes in a sense, and then it can be taken out. It's not something that stays in, correct?
Yeah, correct. Yeah, it can be a one-time only as opposed to a port that's inserted and stays in place. So yeah, absolutely.
And a port or something that stays in place would be someone who needs continuous therapy, possibly daily or every other day, and it's more like an antibiotic.
Yeah, absolutely. Yeah. Yeah. So people who get Myers or high dose vitamin C, they're often getting it once a week or 3 times a week, depending on, what they think and what their physician thinks is best for the patient.
Great. So again, it's just a whole team effort for a nice, healthy lifestyle.
Yeah, absolutely.
Awesome. Well, Karen, thank you so much for being here today. This information has been wonderful. I think if anybody has any further questions, please do not hesitate to contact us at AmeriStaff Nursing Services. We can gear you in the right direction to living a healthy and safe lifestyle. Our number is 248-288-2270. Stay safe and healthy.
My name is Greg Jamian, and I bring you our series on boomer health so we can explore together important healthcare topics impacting the baby boomer generation today. As a home health professional for over 40 years, I'm happy to share my team's knowledge as baby boomers seek answers to difficult healthcare questions. This show provides valuable resources, ideas, and tips, and cutting-edge solutions that will improve your everyday life and health. Don't forget to join us for all the other shows in our Boomer Health at Home series.